Good afternoon, everyone. Please introduce yourself in the chat, your name, your pronouns, and organization if you have one. Thank you for joining us for today's conversation, 100 Days In, How HIV Advocates Are Meeting the Moment. I'm Jada Hicks, and I'm thrilled to be moderating today's discussion hosted by the Center for HIV Law and Policy. As we all know, the first 100 days of the Trump administration have brought a wave of executive orders, agency restructuring, and funding cuts, many of which threaten hard-won progress in HIV prevention, treatment, and health justice more broadly. Let's be clear, this is not politics as usual. In just a few short months, we've seen a rapid-fire agenda that targets the most vulnerable communities, especially people living with HIV, transgender and queer people, Black people, people of color, and low-income communities. It's been a tough few months, with a rapid-fire series of attacks that feel designed to overwhelm resistance and make it harder for people to understand what's happening, let alone fight back. Before we dive into our discussion, I want to briefly highlight some of those prominent actions that we've seen so far. So let's start globally. The Trump administration has proposed more than $1 billion in cuts to international HIV/AIDS programs. That includes substantial reductions to PEPFAR, the President's Emergency Plan for AIDS Relief, and the Global Fund, which together have provided life-saving HIV treatment, prevention, and infrastructure in more than 50 countries. These are not abstract numbers. In some countries, treatment disruptions are already happening. That means real people are missing doses of HIV medication, prevention programs are being scaled back, and frontline providers are operating without stable funding. To make matters worse, the administration froze PEPFAR funding, halting program activities across the globe. Although there is a limited waiver, it is extremely limited to life-saving treatment for vertical transmission. Care and prevention services have been delayed, testing and treatment outreach have been stalled, and community trust has been thoroughly undermined. We're talking about a program that has helped save over 25 million lives since 2003, suddenly destabilized at a time when continued access is essential. Domestically, the situation isn't any better. We saw right out of the gate the use of executive orders and administrative guidance aimed at rapidly rolling back federal protections. One of the first executive orders revived and expanded harsh immigration enforcement. It eliminated earlier priorities that offered some protection for vulnerable groups and authorized broader arrest and deportations. We also saw a resurgence of attacks on gender-affirming care and trans communities more broadly. Within weeks, federal agencies began stripping references to gender identity from public-facing materials, including health resources and civil rights pages. And these weren't just symbolic moves. They signaled a deeper intent to erase protections across federal programs. More recently, the Trump administration rescinded 2022 guidance from the Department of Health and Human Services that had extended anti-discrimination and privacy protections for transgender individuals under federal healthcare laws. This rollback removes federal recognition of gender identity in healthcare settings, potentially allowing insurers and providers to deny coverage for gender-affirming care. Then in March, the Centers for Medicare and Medicaid Services released a proposed regulation that makes several policy and operational changes to the Affordable Care Act. One of these is the end of the coverage of gender-affirming care as an essential health benefit. Another proposed policy from the State Department would make it harder for transgender people to update the gender markers on their passports, adding bureaucratic hurdles that function as identity-based discrimination. And just weeks ago, President Trump issued an executive order titled Strengthening Unleashing America's Law Enforcement to Pursue Criminals and Protect Innocent Citizens. And while framed as a public safety measure, the order empowers federal law enforcement agencies and threatens to expand criminalization, particularly in Black, Brown, and immigrant communities at a time when we should be investing in care, not cages. And this ramp up in policing and criminalization is happening alongside equally dangerous rollbacks in care. The administration's punitive approach isn't limited to law enforcement. It's also being reflected in how and where resources are being taken away. Take the proposed federal budget, you may have heard referred to as the skinny budget. It includes a general 26% cut to the Department of Health and Human Services and specific attacks to the Ryan White HIV/AIDS program, which offers essential medical care and support services and medication to low-income people living with HIV. The overall impacts remain uncertain because we don't know the full details yet. In addition to threatening Ryan White, the budget proposes eliminating the CDC's Division of HIV Prevention and all funding for ending the HIV epidemic initiative. effectively undermining the backbone of the federal HIV response. These programs have been central to the prevention and community partnerships, especially in the South and communities hit hardest by HIV. Cuts to AIDS education programs and innovative care delivery projects means that community-based organizations, especially those serving Black, Brown, and trans communities, may lose critical funding to do their work. These are the programs that reach people who are often left behind by mainstream health systems. We're also witnessing a deliberate dismantling of the federal public health infrastructure with cascading effects across every major agency responsible for disease prevention and health equity. At the Department of Health and Human Services, whole departments and thousands of staff have been eliminated or frozen. At the Centers for Disease Control and Prevention, it is undergoing a major restructuring, including the closure of some labs and the reassignment of entire departments, cutting down on HIV surveillance, disease research, and emergency preparedness. The National Institute of Health has seen its budget and staffing slashed. In addition, NIH has seen $1.81 billion in grant funding terminated, although some reports are indicating that number is much, much higher, with multiple grants canceled midstream, including research focused on infectious disease and community health. In some cases, funding was pulled for purely political reasons. And the administration has also proposed capping NIH research budgets, threatening long-term scientific innovation and stability for researchers, including those working on HIV treatment, vaccines, and comorbidities. SAMHSA, the Substance Abuse and Mental Health Services Administration, is facing staffing reductions of up to 50% and funding threats totaling a rescission of $1 billion in funding, even as the nation deals with intersecting HIV, mental health, and substance use crises. Another area of concern is the Office for Civil Rights at HHS, which enforces anti-discrimination protections in healthcare. This office has played a key role in defending LGBTQ+ patients, particularly transgender people, against healthcare bias and denial of services. Now that very office is facing major budget cuts and proposed rollback of its civil rights authority. This is happening alongside an intensifying wave of attacks on trans rights, from state-level bans on gender-affirming care to increased surveillance and criminalization. These cuts are not just bureaucratic reshuffling. They're calculated decisions that weaken the nation's ability to respond to public health emergencies and disproportionately harm marginalized communities. Taken together, these attacks are not isolated. They're part of a broader strategy to undermine public health, defund HIV care and prevention, exacerbate health disparities, and erode the civil and human rights of the most impacted communities. Today's discussion is about what we can do in response, how we resist, how we organize, and how we move forward with a vision rooted in health justice, racial equity, and collective care. I want to begin by introducing our panelists. And so I'm going to yield the floor and start with Sean McCormick for introduction, please.
Good morning, good afternoon, folks, and thank you very much for joining us today. My name is Sean McCormick. I am a staff attorney with the Positive Justice Project at the Center for HIV Law and Policy. PJP, the Positive Justice Project, is our national campaign to end the criminalization of HIV and other stigmatized health conditions. We work with state and local coalitions that are doing the work. We support them with legal and policy support that's driven by their needs. Really honored to be here today and join in this discussion. And I will pass it to Chauncey.
Good afternoon. My name is Chauncey McGlathery. I am the Director of Public Policy with the American Academy of HIV Medicine. We are based in DC, although I am based in Atlanta, Georgia. We are the largest organization that credentials HIV providers all over the nation. And when we say providers, we're not just talking about MDs, but we're talking about nurses, pharmacists, and physician assistants. So we have a very diverse professional profile. Very excited to be here in this conversation. Thank you. Michael?
Thank you, Chauncey. Can everyone hear me correct? Yeah, okay. I'm Michael Elizabeth, they, them pronouns. I'm the Director of Public Health Policy at Equality Federation. It's an honor to be here today. And I also happen to be the co-chair of the U.S. People Living with HIV Caucus with the amazing Vanita Ray, as you see her punching, because I kind of was forced into this. I'm joking. It's an honor of my life. Equality Federation is an advocacy accelerator rooted in social justice, building power in our network of now 52 state-based lesbian, gay, bisexual, transgender, and queer advocacy organizations. In fact, I'm at the office of one of our state partners, Free State Justice in Maryland right now. We believe the greatest opportunities for victories to improve the lives of LGBTQ plus people are in the states where the work is hard, but the impact is great. The Equality Federation builds state-based leadership and resilience through our programs to catalyze the national movement for equality and win policy changes. My specific role is to build our new public health policy department, including activating LGBTQ plus advocacy to help end the HIV epidemic as we know it, while addressing other health disparities impacting LGBTQ plus communities' quality of life. Our public health and HIV advocacy partnerships help expand state LGBTQ plus advocacy organizations' ability to improve HIV policy at the state level. And all of our partnerships and programs are rooted in a deep commitment to racial justice and a meaningful involvement of people living with HIV, or Vanita would kill me. And without further ado, Vanita.
If I can get off mute. Hey, everybody. Good morning, afternoon. Vanita Ray here, pronouns she, her, aya. I'm coming to you today from Houston. I am the other chair, the co-chair of the U.S. People Living with HIV Caucus with the famous Michael Elizabeth. The caucus is about 15 years old, 15 or 16 years, I'm forgetting right now, but it is a national voice. It is a collective voice for people living with HIV in the U.S. It is a fully volunteer organization, originally started around the time the brain trust of people like Vanessa Johnson and others when the first national HIV/AIDS strategy was developed under Obama, and for a way to make collective input to that strategy. And the caucus was formed. Now we are partners in AIDS Watch. We're partners with USCHA, with NMAC, and CIRO, and others with HINAC, HINAC 6 coming up. So we are one of the only national constituent-led organizations in the country of people living with HIV. So our goals are not necessarily to end the epidemic. We don't want HIV here, but we're here for our care and our quality of life for people living with HIV. I also represent an organization called Black South Rising, and I want to mention it because I'm executive director, because the mission of Black South Rising is to build political power in the South as a way of improving health outcomes and using a political determinants of health framework, which is more upstream, as a way of building power with political education and radicalizing and folks and creating a political home for folks, which is really needed right now. So I'm excited to be here. I'm tired. I'm not happy that we're having to go through this. I'm not surprised by this. I want us to stop sugarcoating it around, calling it about funding. It's about Black people. It's about a fake ass meritocracy that we have never had. It's about elimination of gains that people have fought for years. This is bigger than HIV. And as a woman living with HIV, Black, of course, in the South, I have a lot of arrows in my ass besides HIV. So it is attacking things for my grandsons and all of the future and of our people, all of our people, immigrants, documented and not. So I think we got to elevate the conversation to higher than just saying, oh, we're losing money for HIV funding. I want that, but we need to also talk about what's really going on here in order for us to better plan how to resist and how to build in spite of. So I will turn this over to John and go back on mute.
Good afternoon, everyone. Thank you so much for having me. My name is John Mead. I'm Senior Program Manager for Policy at AVAC, and AVAC is an international nonprofit organization that leverages its independent voice and global partnerships to accelerate the ethical development and the equitable distribution and delivery of effective HIV prevention options as part of a comprehensive and integrated pathway to global health equity. So we track from research to rollout to ensure that those who are involved in the research should be involved in the research, and it gets delivered to the communities that need it the most. I'm also here and I work in policy, so that I basically run and lead our government and federal relations. So working with Congress and other federal agencies around access to HIV prevention options. My other hat on this webinar is as the founding member of Prep and Black America, which is an intersectional informed social justice movement comprised of Black queer advocates, activists, researchers, policymakers from communities disproportionately affected by HIV in the United States. What we do is we aim to support and empower Black communities to interrogate systems of inequity and reclaim control over our own sexual and reproductive health narratives. I'm excited to be here. I'm excited for the conversation. Thank you for having me.
Thank you all again for being able to join us and participate in this panel. As you all can see, we brought in the heavy hitters for this in-depth discussion. So I want to start by zooming out a bit. In just over 100 days, we've seen deep cuts to public health funding, attacks on evidence-based care, and open hostility towards Black people and communities of color, LGBTQ+ people, and immigrants. I want to know what stands out to you as the most alarming or telling shift we've seen in these first 100 days under the Trump administration, and what, if anything, about how community or specific leadership has responded has felt equally concerning or revealing to you.
I mean, I'm happy to build off of what Vanita already started. That tends to be our pattern. And you can tell that I'm a child of Vanita when I say this, but we do need to be honest and frank with ourselves and name all of the daily developments are a coordinated effort to dismantle civil rights protections and progress we've been making since the 1960s. These attacks are on Black people. These attacks are on migrant communities. These attacks are on LGBTQ+ communities, transgender and gender expansive communities to be specific, and communities with the ability to give birth, are designed to reestablish and further cement white supremacy. Oh, and my comms director did not approve these comments, so I am speaking from my heart, and so also hope I don't get fired. But these inhumane gutting of public health funding and attempts at further restricting healthcare access for millions of Americans is a symptom of Trump's war on non-white Americans. Beyond the daily tragic updates, what's most alarming is how effective they are being with dividing our movements, leaving us to fight for our own individual rights and survival, limiting our capacity to holistically unite for a coordinated response that mobilizes all of our communities impacted by Trump's war in America. To talk on your second question, Jada, and this is more personal experiences, I am a little disappointed with how siloed our strategy sessions have been. And our over-reliance and dependency on federal policy and advocacy. The prevailing narrative that we all have to start leaving some communities behind is becoming more common in traditionally assumed safer spaces for trans and LGBTQ communities. Now is the opportunity, quite frankly, for new leadership, new strategies, new tactics that we may haven't used since the height of the civil rights era and our fight against HIV, to even never before tried strategies that may be more appropriate when fighting back against a regime.
Just to add in there, so one of the things that I find most alarming, right, in the first 100 days under the Trump administration is the systemic dismantling of global health and research frameworks that have been crucial to both scientific innovation and public health, and how fast it has come to be, right? It showed that these systems were fragile to begin with, right? How fast it can be dismantled, right? Cuts to NIH, CDC, USAID budgets paired with the elimination of Fogarty International Center in NIH, which talks about global partnerships abroad, mostly in Africa, to be quite honest, right? Signal a retreat from global collaboration that has historically driven breakthroughs in vaccines, treatment, and epidemic response, right? And this retreat also weakens our position as a global leader, right? And these policies that also target LGBTQIA communities, both domestically and internationally. The rollback of protections for transgender individuals, removal of LGBTQIA health data from federal websites, the defunding of HIV and STI prevention programs underscore an erasure and a broad attack on these marginalized groups, right? And I agree with what Michael and Vanita were saying. Like, we need new leadership, right? Like, this is what the Trump administration wanted: distraction and dissent. They want populations to cannibalize each other, right? To have their interests or their identity over this one that population that they've worked with in the past. They want to be like, okay, we need the funding, so we're gonna throw this community under the bus so that we could get the funding, and vice versa. So like, this is exactly what they want. And these court cases are a distraction. Right? They want this. They want things to be tied up in the courts so that they can continue doing their executive orders, putting out their guidance, do their restructure under the guise of, oh, we want efficiency, we want to eliminate waste, etc. Right? This is a distraction tactic, and quite frankly, they're winning at this point. They're winning. But what we need to do is we need to resist, and we need to find a way to work together.
So, I've been extremely disappointed. I'll say, and I agree with everything John and Michael Elizabeth said. In our leadership, there is, I feel, a sense of doing business as usual when we're in crisis. We're going to conferences. And I understand that we need to practice some joy in the midst of this, but this is not business as usual. You know, our leadership, and I like me some Hakeem Jeffries and them, you know, him and Cory Booker did a sit-in on the steps of the Capitol. That's what our leadership has done. I mean, I think that's what I would do, but they have access everywhere. One of the other things that's so alarming, we watched this in 2016, how this came about, when we knew this, and we saw January 6th and we knew this. And in 2020, everybody got in the streets and marched after George Floyd. And for a moment, I even thought, ooh, have we turned a corner? And what I found out in the next election was people just got Facebook mad, Twitter mad, marched in the street and went in and voted their privilege in that ballot box, voted against even their interests. And then we saw who this person was and this agenda. You know, the level of mediocrity that we accept, the level that only, white men can get away with in this country. You know, impeach, criminal. Even when Blacks or immigrants are the subject of violence, we could be the victim, and our criminal record is the lead in the story, not the fact that we were harmed. But yet we have it backwards. And what is 2020 happened, and I was so disappointed, and people thought I should be happy because Biden won, but the 70-something million that still voted for this still hurt. And so I'm not surprised that we came back here when in the face of a Black woman with some sense, we would choose this. That's, you know, it reminded me that I'm still in the America I thought I was in, that I hope was changing. You know, after 2024, I start calling the U.S. a plantation, because now you can't say this. You know, our fourth check and balance is being challenged. Free speech. You know, folks don't even ask the right question. If you don't say the Gulf of America, you are not given access. I mean, the acceptance of this for some DEI fake ass solution is that's one of the things that's really appalling. And we want to keep talking respectability when this stuff is deep down. You know, the backlash from Obama, 8 years, the idea that the world is browning and folks are trying to retain power. And so the sheer magnitude of it, we got a Supreme Court we can't depend on, we got a Congress we can't, and we got an executive office who says they can do what they want. And even though a lot of people are in the streets, it is happening. And so that's the sheer magnitude that our artifacts are being taken out of the museum don't seem to bother anybody, or that our history, or that the majority of Blacks in the US live in the South, and we have some of the strictest laws in the South of access to reproductive care. Women are dying on the sidewalk in Texas, where I live. And so they're having a Congress that's voting on whether you can deport me without due process or not. I mean, with, straight challenge to the Constitution. So it is the mind-bogglingness of this that I had hoped we had come somewhere we haven't. And we've got to dig deep, because if we don't address, and it's the same to me with HIV and Indian epidemic, I want every tool we got, PrEP, everything. But can we sustain 20 years of people on PrEP? No. If we ain't got a job or a house, you still got to deal with the things that people need. So, and the fact that this epidemic is disproportionately Black, I remember in 2016 going to DC, and we were kind of talking about how do we white size this epidemic so we could appeal to this administration. The fact that we stopped PEPFAR, and most of the people that are dying are in Africa and Black. And then most of the people in the US are Black and poor. And so there is no question about what is really going on, but we're having to pick off pieces of it. And I got to be on here to pretend like I'm not being attacked as a Black woman living with HIV in the South, but just because I'm living with HIV and I'm being stigmatized further. So the sheer magnitude that this country didn't think we could go this way, where we're looking at an aristocracy or an oligarchy and authoritarianism of someone decide, Harvard, you can't do that. We have law firms giving in. We will only do what you say. So the magnitude of this is good. And let me just say this last point. The firing of so many federal workers, let's be real, when the federal government hired, it was the way to the middle class for Black folks. The majority of people who probably got fired were Black. So to remove that as an avenue of income and employment hurts us the most. So there's just the big magnitude of it all, and the acceptance. I still think I love seeing the protests, because my body is not getting ready to get beat up. January 6th, they got away with it. Me, they wouldn't. We'd be dead. And everybody would say we deserved it. So I just think the magnitude of it is striking to me, and the ineffectiveness of our leaders. We have so much fodder right now, but there is no messaging coming from a party that we could support right now with all these targets. So there's no leadership, I feel. We're trying to figure it out, and we're doing it with limited resources, and we're trying to sustain an organization, or are we trying to save our life? I'm trying to save my life. Some people need to sustain their organizations so that I can do that, but I think sometimes there's a conflict. Are we trying to play the game, or are we trying to tell the truth? And I say, let's tell the truth and rebuild something better.
Thank you. Yeah. And I mean, to build off these points, these attacks are the most obvious and direct, vicious attacks that we have seen in our country. The administration has made it clear that they're going to be targeting Black and brown communities, LGBTQ folks, and this is just the beginning. So that is what strikes me as the most alarming. But in a similar way, this type of overt lawlessness that they're going about and doing it, how they're getting this done is what is very surprising and shocking. For example, we saw the freezes to domestic and international HIV prevention and care funds stopped. That is, judges ordered that the funding be restored, but we saw the administration mess around, arguably intentionally, in a way that severely undercuts the whole purpose of these programs and sows uncertainty moving along, because they're going to just continue to do this process. We have seen this with immigration enforcement, really disturbing, heartbreaking examples, blatantly disregarding court orders to bring back Mr. Abrego Garcia and many, many other immigrants. These examples speak to the way that they're going to continue to just do this process and just see how far that they can go. And this is my second point, and the main point that I would say is I'm deeply concerned about preemptive compliance and the way that organizations and people are shifting their policies and practices in an attempt to avoid, at least temporarily, the wrath of the administration while playing into the white supremacist and transphobic narratives that they're pushing out. For example, we've seen that universities crack down on students who are protesting genocide, fully defunding departments of African American studies, all in an effort to acquiesce and avoid further attacks. We've also seen hospitals that have delayed treatment or gender-affirming care for minors just to try to avoid future attacks. But we know that that's not going to actually work. This administration will not stop when they see compliance. They'll view it only as an invitation to keep going. So it's vital that we call out those organizations, hospitals, universities, people within our own movement that are acquiescing to these narratives. I also see that organizations that are specifically using the talking points of this administration, whether it's financial responsibility or whatever Doge is pumping out, congressional Republicans too. But we know that it's not about financial responsibility. Public health has always been made financial sense. It's actually about dismantling and defunding the programs that are solving structural issues affecting people who are Black, brown, queer, trans. And we need to reject the lawlessness from the start. We cannot be accepting any sort of anticipatory compliance or inaction by people within this HIV movement as well as broader movements.
I only have one thing to offer that hasn't already been said. I feel like if no other question was answered, this conversation has already given us the kind of breath that I have never heard in any of these conversations. And that's kind of what I'd love to focus on. Several years ago, half of the people on this call were in a meeting with policymakers. And the question was asked, what are we doing to prepare for the moment when we lose power in the House, Senate, and White House? We had the opportunity years and years and years ago to prepare for this moment, and we decided not to. We were lulled to sleep like sheep for the slaughter, and now it's killing time, and we're all going to die progressively over time because we waited too late. And so my question is, how will we make sure that 5 years from now, 10 years from now, 20 years from now, we haven't just been in a killing field this whole time? When are we going to get to the point where we say enough is enough? I'm incredibly disappointed in a lot of our leadership, but I believe the reason why we've gotten to this place is because there is no accountability. There's nothing that happens when our leaders lead us off a cliff. And so here we are.
Thank you all. I so love hearing your insights. That was just very powerful. And thank you for naming things specifically as you see them. That's so needed in this moment. I'm glad that we're having this conversation. I want to shift gears and talk about infrastructure. So policy decisions aren't just ideological. They're upending the very systems that we depend on to stay safe and healthy. From layoffs to lab closures, we've seen sweeping changes to public health agencies. So how might the dismantling of key public health agencies like the HHS, CDC, NIH, and SAMHSA undermine not just HIV services, but the infrastructure for any kind of responsive public health policy and erode public trust in science-based policy?
I could start with NIH focus, because that's what AVAC really focuses on, right, is the research. This administration has proposed to eliminate the National Institute of Minority Health and Health Disparities. What does this institute do? It supports research on racial health disparities, including higher HIV, diabetes, cancer, and maternal mortality rates among Black Americans. Discontinuation of DEI-anchored research, gender-affirming care studies, and community-based interventions. It's also proposed to eliminate the Fogarty International Center within the NIH. If you don't know what the Fogarty International Center was, it currently exists, but it might not in the next couple months. It is key for global Black health partnerships. For example, HIV research in Africa, right? They are proposing to eliminate it. Erosion of health research capacity. The cuts to NIH reduce the capacity for breakthrough medical research. We wouldn't have PrEP or without NIH-funded research, right? Slowing progress in the fight against HIV, STIs, and other critical diseases that plague our communities. Loss of scientific independence, right? Politicizing research priorities, risks sidelining evidence-based approaches in favor of ideological agendas, compromising the quality of scientific inquiry. I don't know if you all was listening to RFK Jr. last week at these hearings, or even yesterday, the spewing of dis and misinformation and talking about, oh, China doesn't have DEI programs, so we need to get rid of DEI-focused programs. I'm like, it is utterly ridiculous, right? The public mistrust in science, we already had that before this administration came in, right? That was evidenced during the COVID-19 pandemic, right? But right now, with a stroke of a pen, right? Eliminating PEPFAR, eliminating all of these research projects, having people having to go into clinics, getting called back into clinics because they're in a clinical trial and a device has to be taken out of them because the US government just decided not to fund research anymore. Like, this erodes not only trust in the United States, but globally. You think these communities are going to ever, if we get back to research as it was, which wasn't perfect, but it was better than what we're doing right now? No, the trust is gone, right? With a stroke of a pen, the trust that we have built for decades in this research enterprise is eviscerated, right? So that the infrastructure that was built, gone, right? So like, I just want to lay out, like, these are practical examples of how the NIH is under attack, continues to be under attack, and the crucial research is being halted, terminated. The majority of the grants at NIH that has been canceled have been focused on HIV, STI, anything DEI related, anything trans and gender affirming care related have been destroyed, terminated, right? This is a targeted attack. This is not by accident. This is not coincidence. This is intentional genocide, essentially, right? Because they want to erase these populations. They don't care about the health and well-being of these populations. So they're just stopping all of these and destroying the infrastructure that supports the research to make these populations healthier, be able to thrive, and live robust lives.
I guess I'll just quickly add, co-signing everything. And John, I completely see how and why you founded or co-founder of PIBA. I'm in constant awe of your expertise. But to reiterate another point about public trust in science, is completely being eroded. And we saw, and we always tend to name, at least historically, around particularly around science, public health trust, and Black communities, right? Which is why at times we even saw the hesitation to get things like the COVID vaccine. But we're hearing from partners, friends, colleagues who have committed their careers to researching issues that impact Black communities, Black queer communities, being told by their federal government that their entire career and life's work is no longer considered science-based research. Like the ripple effects of that, beyond the funding cut, beyond the layoffs that research teams have to do to their entire teams and staff, there is also sort of like a reinforcement of the stigma and legitimization of our communities as valid, real communities deserving holistic health, deserving of understanding what contributes to our health outcomes, et cetera. And that was not part of my talking points. I'm going to get back on track. But COVID showed us both how important and how strained our public health infrastructure already is. So what we're seeing now is from the administration is a weakening of an already stressed system. There are very concrete impacts of dismantling of these agencies happening in real time. Cuts to funding, elimination of institutional knowledge, shifting burdens to the states to make up for where the federal government is no longer a partner in promoting public health. I want to reiterate that. Shifting burdens to the states to make up where the federal government is no longer a partner in promoting public health. That means we already have a patchwork network of how you access states, the quality of life you have depending on where you live in the country. That is going to worsen and require our state governments to take up the responsibility way more than we probably ever have in the history of this country. Over time, we will not have the same ability to understand how prevention and treatment efforts are reaching people who need them, or even if they are. We will have fewer opportunities to partner with community-based organizations and other key stakeholders who are on the ground. All of this will continue the erosion of trust and mean people will take themselves out of collective efforts to help fight not just HIV, but all the different health disparities that impact our communities.
I want to just say something. I'm glad you and John, we talked about science so much, and I pay attention, but clearly not a researcher. But what I also think we have to uplift, we have a federal government operating illiterately in science. You know what I mean? When you dismantle, so there's no we don't believe in climate change. We had tornadoes in Alabama yesterday. I mean, so we have a government that is taking us back to the cave times because they don't believe in science. And so if we don't operate that way, the rest of this goes as well. So there's a bigger thing. My best friend I talked to yesterday on the phone, and she's like, but Vanita, can we fix this? Because people keep saying 4 years, 4 years. This can't be. When she said it, it blew my head because I started thinking about all of the pieces. And I always have to have hope, but damn, this is rough. And one of the things I want to say on infrastructure, the states have to get ready. So if you're on this call and you go to city council or your county, start asking them, how are you all getting ready for less Medicaid if you expand it, or monies, or less where there's going to be more pressure, just like Michael Elizabeth said, put on the states to respond to this. Some of us who are doing advocacy gotta focus more on state at the state level, because the game over there is just. But those of us who are in the red states, that's being kind of hard. But I just really want to say the infrastructure, we got to depend on our states and stuff now, and they are not ready. And I don't think there's still disbelief. So all of us to be going to our local representatives and saying, how are we getting prepared for what's already here? Because they ain't started.
I just want to add to the state conversation. My father was the first Black man to attend the University of Alabama in Huntsville back in the 60s. In order for him to do that, the president of the United States, John F. Kennedy, had to dispatch the National Guard to Alabama to walk him from his car to the school. Before that, there was bomb threats called into our house. There was a gentleman drove a truck into our house because of the threat of integration back in the 60s. I think part of what's happened, we have isolated the HIV movement from everything else that this country has been and known. And part of the vulnerability that Braidwood has exposed is that we've gotten too comfortable in too small of a tent. We've relied on resources that were political, that were motivated, that had interests that we didn't know. There are relationships behind the scenes that haven't been exposed. There's federal funding for groups that we thought should be advocating for our interests. So when the federal government changes its policy, then all of a sudden, people that we've depended on to create agenda and direction for us, they're torn between. They're at conflict. And one of the reasons why I'm so excited that we've got John on this call, because I think that some of these ideas is we should have never depended on someone else to tell us which way to go. The whole idea that we ever ended there just proves that we segregated our movement from criminal justice, from human justice, from civil rights. We know better. It is ridiculous that we're having this conversation. This is a Jim Crow conversation that we're having. It should be impossible. But the reason why we're here is because we have forgotten all of who we were. Now, this isn't a surprise to many of us who've been working in HIV for a few decades, because as Kenyon Farrow and several others will tell you, we have the opportunity to center justice in the HIV movement, and we decide not to. The reason why the Ryan White program isn't named Jamal Turner is because it made better sense politically for us to have a white suburban name as the head of our financial movement. We've made choices this whole time, and now we're paying the price. The question is, when will we change course and create funding streams that are not so susceptible to corruption?
Wow, Chauncey. Yeah, I mean, that's it. That's it right there. I think that is going to be very much what I want to emphasize with the closing message, is that we need to be more intersectional. We have to be focusing on ways that we can incorporate everyone that's impacted, especially people with intersecting marginal identities. So I do want to get to, Jada, your point about restructuring, and it just that we're already seeing this play out in destructive ways. We just saw the HIV surveillance report lacking any data on incidents or PrEP data, but more broadly, it means that CDC is not able to respond when Milwaukee Public Schools says that they need help ridding their water of lead. So we continue to have lead in a inner city school system that should have been ridded of that decades ago. I think in particular, when we have the leader of the Department of HHS saying, "Don't take my medical advice," really speaks to the way that trust is totally out the window. And I can't imagine that people would be able to trust that, especially building on the legacy of racial exploitation and research. So I think these effects are already being seen. We are just seeing the beginning of it, though.
I definitely agree that this is just the beginning, and it's the tip of the iceberg. So I want us to go a little bit deeper into the specific programs under attack. So we know that these aren't just numbers in a budget. We know that they are literal lifelines for people in our communities. So what are the risks and harms of proposed and enacted funding cuts to programs like Medicaid, PrEP access initiatives, and Ryan White? And can you speak to how this is playing out on the ground in your work or community?
I'm happy to, this is a large question, to be clear. And I had a hard time even trying to summarize all of this, which, back to Benita, John, Sean's, and Chauncey's point, that's by design. But just to make sure that we're all at least on the same page, and things are being updated hourly at this point, so this could be outdated information at this point already. But recently, the U.S. Department of Health and Human Services terminated over 42 pages of grants, totaling a 12 billion loss to programs, ranging from not just HIV though, and this is why Benita's point earlier is so potent, It also impacts Alzheimer's and cancer research, like literally every type of disease or epidemic that can impact, quite frankly, every American. These cuts have jeopardized and in some cases halted entirely the critical public health work of our state and national park. But I also want to help expand understanding of how this impacts, LGBTQ communities, particularly our transgender and gender expansive communities that are sometimes feel like target number 1, 2, or 3, or all the above for this administration. As of 2022, 276,000 transgender adults were enrolled in Medicaid. And so as like this week and last week, when we were all under real fear that Medicaid was about to be gutted, the implications of that for LGBTQ communities, in particular transgender communities, with gutting Medicaid would actually be the single most effective way of reducing access to gender affirming care for transgender communities. More than any state gender affirming care ban can do individually. Medicaid isn't just important for those of us living with HIV. It's also important for those of us who are trans and living with HIV. And what we have to also address is it's not just the dismantling of funding for Medicaid that's putting our access in danger. It's these racist work requirements they're instituting. It's these attempts to make certain forms of care not covered, like gender affirming care, but even possibly forms of like PrEP coverage, et cetera. These recent moves aren't just policy failures, they are moral failures. And they represent a profound disregard for health and survival of LGBTQ plus communities who rely on these programs.
And I'd love to jump in and just talk about what these programs represent beyond just immediate care is that HIV care is essential for protecting against criminalization, because we know that these laws are in place. So if Medicaid is restricted or ridiculous work requirements are added, healthcare access will likely be restricted as well, and those clinical outcomes like viral suppression will be jeopardized. And because many of the HIV-specific laws that are on the books only maybe allow for a narrow defense of if the person has a suppressed viral load, this means that more people will be under the threat of criminalization, prosecution. And then undermined healthcare access for prevention or treatment services increases the likelihood that more people, that there will be more transmissions, increases the likelihood that especially Black, Brown, and LGBTQ folks who are made vulnerable to HIV are at risk. So these cuts simultaneously open up the possibility of arrest, prosecution, and incarceration for people who are newly diagnosed.
Okay, with that, I'm going to move us along. I'm apologize for time purposes. I'm going to skip us ahead just a little bit. So I want us to zoom in a little bit on what's been unfolding domestically. So with Trump's executive orders and administrative rules targeting healthcare access and civil rights protections, especially for transgender Americans, for example, Michael Elizabeth, you touched on this some, and bans on military service, changes to federal websites, proposed ACA rules, and attacks on gender affirming care. How has this impacted your work?
It's stressful. No, I want to personalize this, and then of course I get back to the actual like policy implications. I think this moment actually highlights. Sometimes I honestly look at my computer and I freeze because there are LGBTQ and oftentimes specifically anti-trans developments happening simultaneously to attacks on our overall healthcare access or HIV specific prevention and treatment access points. And both mobilization efforts are so far always segregated from each other. And so like, how do I as somebody that has to operate in both lanes, in both movements, and quite frankly, operate under several different intersecting identities that are impacted simultaneously, is supposed to respond, right? In a comprehensive way that isn't adding to the fact that I'm working 24-hour days at this point. And so that's also by intention, right? To really spread us thin, to really exhaust us. But ultimately, and so how is it affected? Like, it's affecting our ability to mobilize, it's affecting our ability to organize, it's affecting even, so what do we ask for funding for? And where is there space for us to have a comprehensive analysis and response that is not segregating us or forcing people to choose communities to prioritize in the moment? Now I can go back to what I'm supposed to say. It's abundantly clear that the administration is taking a whole of government approach to restricting access to care and turning our nation's civil rights infrastructure on its head in order to weaponize it against different groups. These efforts have impacted our work in multiple ways. As nonprofit organizations, we have had to worry about our own ability to stay in operation. Some of our, it was referred to earlier, some of the law firms that at times even on pro bono cases fight for us and represent us are being specifically targeted and executive ordered by the administration. There's even fear at times that we can be designated as a terrorist organization. Our research and direct service partners are losing funding. The reality is that federally funded LGBTQ related research has been decimated and would need significant efforts to recover. The New York Times, which at times we're not fans of, but anyways, the New York Times estimates at least $800 million in funding has been slashed in research alone. That isn't just about stamping out our ability to gain new scientific knowledge. Research funds support people getting access to medication to prevent and treat HIV. It supports students in developing the next generation of leaders. Our community members are trying to navigate an onslaught of policy changes to understand what it means for them and for us and our families, and experiencing real fear. And that's the part we need to emphasize. The fear component is beyond any policy development. I am actually very concerned beyond the explosion of rates of new HIV transmission. What is the mental health impact of this new regime that we're experiencing? And because of dismantling of the research and also the health infrastructure, how are we going to actually take care of the mental health of our communities? And by extension, of ourselves who are fighting and who our communities depend on for us to be effective advocates and leaders and to respond to the moment of now. Our partners like LGBTQ supportive state and local governments and healthcare facilities and providers are being put in terrible positions of trying to determine how to protect themselves from politically motivated investigations and continue to serve everyone in the community while having to fend off threats from not just the federal government. In some tough, quite frankly, I know we're nonpartisan, but in some tough and red states, their state government, like in Tennessee, like in Texas, are adopting Trump-like practices and targeting our health centers with specific investigations on how are you serving communities. I know you took gender affirming care off your website, but let's actually request records to prove that you're not providing the service anymore. So this is going beyond the federal government. State governments who are in hostile states are replicating these practices at home as well.
You know, as a person living with HIV, and we're leading all volunteer national organization for people living with HIV, we're just, all of the othering that is going on exists for us. We are trying to come up with responses without funding. We're trying to sit at the big boys and girls and persons tables who have some funding, but we're the only ones there, people living with HIV, but we don't have the money, right? So one of the ways that it's affecting us is, you know, we have a policy document, but we don't have anybody to do policy with. There's no inroads anymore. We don't know nobody. And so there was this discussion, do we take a policy pen to a fist fight again? Or if we don't have anybody for the policy, what is the strategy then? You know, the caucus, for the first time that I'm aware of, said added housing as one of our priorities, because there's a lane that already exists for it anyway. And people keep telling us it's important, but we keep wanting to focus, and I was one of these too, on those other issues. Molecular HIV surveillance, y'all, ain't going nowhere. We are being surveilled in ways, my data, just the idea of security, the lack of security in where my data, I don't know what Elon Musk did with our data, where it's at, who has access to it, how many of us are being tracked, you know, so, you know, we are having to worry about, but our constituents aren't saying, stop status neutral, because they're just saying, please improve the quality of life for us. They're not, protect our privacy. If housing is treatment, we, you know, housing, how are they going to eat? So this idea of mutual aid, churches, what I'm telling people to do, everywhere you sit and you spend time or devote money, you need to be challenging in them. It's not so enough to sit up and just say, what are everybody doing? They ain't doing nothing. Everybody is confused what to do. Start somewhere in your church. If your church ain't taking a position, remember, there's strength in numbers. People are afraid. We should be taking a position. I'm not spending time or money nowhere that ain't addressing the issues that are important to my people and me, or my family and the people coming. If I'm spending time over here and it's anti-trans, I ain't there. You talking about a human being that's illegal? We ain't spending no more time there. If you are in a coalition or in any organization and you're operating off of goals or strategies you created in 2023 or 2024, I say you need to stop and sit down. It might be the right course, but you need to rethink of it in this one. And so Mike Johnson, I'm sorry, all these people from Louisiana, y'all should be sitting on his doorstep. I'd be at his house. I mean, there are still things you could do, you know, that I remember back in the old days, they put a big condom on, I think, Jesse Helms' house or one of them, you know, that it's going to take some sacrifice in our bodies on the line. But I want us to be safe. So I'm not asking Black folks to get in the streets. I'm not asking trans folks to get in the streets, because we are the targets. But what I am saying, all the rest of us have an obligation to protect our most vulnerable as well. And where I have access and privilege, I need to be saying the same damn thing I'm saying when I'm with you. So I want your church, your school, your county government. There is no place that we are showing up now that won't be impacted. And if you're not having this conversation in those places, even if it's, let's make sure we know where the food pantries are. Let's make sure we have rental assistance, because all them people that just got fired, where are they? How are they paying rent and a mortgage? So we can't bring a policy pen to a fist fight, but I have this thing about how do I stay true to who I am and fight? Because, you know, I'm a brawler too. But I also believe that we can build something, and it's got to start in every place you live and breathe and spend your time. Security is a big thing. Collaborate. If you're in a CBO and you're not collaborating with another organization, you can't do that no more. You should be going after funding together. If they got a service, you all are doing duplicates, one of y'all stop and share the other. We can't. I understand we want to maintain our organization, but we're trying to maintain the lives of our community too. So this collaboration, we're not, single organization fundings need to go away. If you're not working with people, the caucus, what we're doing, I'm spending more time finding money right now. That's where I'm spending the biggest time, is trying to find money and trying to find ways that people who are counting T cells and dealing with limited income can still participate and not have people prostitute us for our stories. We want to control our own narrative. And so we want 90-second videos, send them to the caucus. We're getting ready to put out something so that we can begin to share our stories in the places that we need, instead of giving them to people who treating us like little others and pitiful people, when we're human beings and grown ass people at that, who don't need somebody asking me, did I take a pill? You know, 3 weeks ago, I tried to get my HIV meds filled, and they called me and said I needed $695. Whoa, I got insurance. I know the code, something done changed. I'm on the phone for hours and I know the system. And the lady tells me, I'm so glad you're calm. And I said, I'm calm, but there's tears running down my face right now while I'm talking to you, because this is life sustaining for me. So I had to run down and do something that I was privileged to do, to go access different ways and end up with medicine. We know there's a kid, someone reached out to me, a clinic in Virginia, Deidre Speaks knows this, went there, the clinic is already closed. Where do they go? So we're seeing this, and for the caucus without any funding, and I say, if you are doing this work and you don't have a constituent-led organization with you, come to the caucus. We need some financial support, but we can help. We're the only organization led and run by for us, and people are having conversations without us. When I'm in the room, we're talking organization and services. There's no place for the conversation for a person living with HIV. When I said I was there for my quality of life, everybody said we're there to end the epidemic. They're trying to end the epidemic, and I'm trying to stay alive. We don't have a federal government that's trying to end the epidemic. So I say you advocate everywhere you are, and the caucus is here to support. We need y'all support because we're the only entity out here doing this on behalf, by and for people living with HIV. So re-examine your goals, everybody. Stop asking what others are doing. Let's start where we're at. And let's put on a call and say, what should I tell my church? Start a petition. Call our congressmen. They come when they need our vote. Bring them to damn church now, right? Or wherever it is. So I'll stop.
I actually want to build on that point, Benita, because you specifically talked about collaboration, bringing constituents to the table. And so I want to name that there's power in community. We're seeing hope, strategy, and creative resistance in this moment. And you've discussed a little bit of this, Benita, with bringing in church members and allies outside of the box. So can you all speak to how organization and advocates are shifting strategies to respond to this moment, and where you're seeing this creative resistance and opportunities for collaboration and power building? And specifically, I want to also focus on, needing solidarity and intentional allyship. So like, what does that look like right now? How can white people, heterosexual people, and cis people show up as co-conspirators in meaningful and accountable ways?
I'd love to jump in on this. One of the things I love about this moment that I hate is that the administration is literally pulling our entire government down. So everyone is affected. There is no community, no demographic, no gender, no people, no orientation, no belief system. Everything is being pulled down at the same time. And so what that does is it creates opportunity for conversations. And it also, to the point I was making earlier, we need to have a bigger message. I think sometimes historically we preach to the choir. And so we have these kind of canned statements that are kind of designed to tug on heartstrings because of the impact of communities. This administration and the policymakers aren't going to respond to that. So I think this opportunity is to expand our table, begin having conversations with organizations and people in our community that we've never talked to before. So what we're doing at the Academy, we're telling all of our partners, you are all advocates. See yourselves as the head of your own policy organization. Everywhere you go, every conversation you have, every contact you have at work, at school, at play, at church, as Benita mentioned, these are all opportunities for advocacy. We have to have open conversations about what's going on now. And so I believe that what we have to empower each member, each representative at every meeting, on every agenda, to be able to talk about these issues at the school board, at church meetings, at education meetings. Every facet of our community needs to be engaged, and every person has a role to play in that engagement.
Yeah, just to add in there, like something that we've been doing at AVAC is where exactly what Chauncey was talking about, empowering researchers to be their own advocates. There's no longer you just sitting up in your ivory tower doing nothing. right? You have a voice. Your funding is getting cut. Your research is getting cut. Most importantly, the folks that are enrolled in your research are negatively impacted, right? Yes, you're in Harvard, you're in University of Washington, you're in all these Johns Hopkins University, but you need to speak on behalf of the people in your studies, the thousands of Black and brown bodies that you are capitalizing on to build your results, to do whatever you need to do. You need to have your voice. And what does this look like? This doesn't always look like going to DC, because as Chauncey mentioned, these people have no heart. They don't care. They want you dead. They want to kill you. So you telling them, oh, these studies are being cut, and like where our people are dying and they need this, that's not gonna work. That's not gonna fly, right? You need to come at them with the economic argument. How cutting funding is going to take money out of your budget, out of your pocket, right? $1 of NIH funding equals $2.86 of state economy, right? So use that as a platform, use that as a message, right? Instead of going to the New York Times and the Washington Post, go to your local newspaper. Like this, the plumber in rural Washington or rural Alabama is not opening up a New York Times. I don't even have access to a New York Times. I have a paywall and I work in this arena, right? I can't even access a New York Times article, right? You need to go to you need to touch the people in your community that will ultimately, if they say, oh, this research that is being done at Fred Hutch is going to prevent my aunt from getting cancer treatment, is going to prevent my uncle from getting high blood pressure treatment, is going to prevent X, Y, or Z, insert disease here and treatment here. That is going to get people mobilized. Oh, like, oh, my senator is trying to cut research funding that's going to affect cancer research, that's going to affect cancer treatment, and my uncle, my aunt, my grandmother, whatever, is dealing with this. That is going to get people mobilized. That HIV is not on the top priority of a lot of people, right? It is not, because they don't see it every day. But what they do see is they're on stage 4 breast cancer, having a mastectomy, or doing all that. That is what they see, right? So we need to collaborate with other advocates and other people from other disease states, because HIV, as much as I've put statements on all these hearings in Congress that talk about HIV, that talk about NIH research, what they care about is Alzheimer's, cancer, all these other diseases. HIV is not the top priority. What we need to do is have our community care that research writ large is under attack. Writ large, it doesn't matter what disease you're talking about. All research is under attack. So we need to have that grassroots mobilization, coalition building, just like Vanita was talking about the caucus. PBA, Prepping Black America, is looking at all these things are coming out, how these EOs and all these things are affecting the community. Nobody's talking about how it's affecting Black people, particularly how these Medicaid cuts are going to affect Black people, right? Because Medicaid expansion states, all of these things are going to affect majority Black and brown communities. But nobody's doing an analysis about that. Everybody is so broad in general. So Prepping Black America is working on doing just that, doing an analysis of how these EOs are affecting Black communities in the United States and abroad. Because we can't have this conversation and not talk about PEPFAR. PEPFAR is being eliminated. PEPFAR is being dismantled. And that is the blueprint, globally, that they are going to do here domestically, right? Clinics shutting down. All of this stuff that's happening in Africa is happening here. And they tried global first because they know people really don't care about global foreign aid and whatnot. So they started there, and now they're bringing it here. That is the blueprint for what they want to do on our land, in the United States. So we need to pay attention, and we need to collaborate. We need to build coalitions, not just amongst ourselves, right? We need to work with the abortion advocates. We need to work with the sexual reproductive health advocates. We need to work with the racial justice advocates. We need to work with all of these advocates and come together, because HIV, I'm sorry to tell y'all, if I'm bursting someone's bubble, is not the top priority. It's not.
John, I think we should, just the idea of healthcare as a unifying message, because we all need healthcare. So why aren't we rallying around healthcare and everything, that gender affirming, reproductive care, healthcare? And I wanted to say something. You talked about, going in there talking about money and stuff. One of our challenges now dealing with this Christian nationalism kind of thing is ideology don't care about money. They care about to give it to, the rich, the buddies who they're working for. But I remember going to Texas legislature several years and trying to argue for Medicaid expansion and showing the money what we were losing in our tax dollars. They don't care. Ideology, they weren't going to move. So when you're going to have these conversations, talk to somebody. So if I go talk to them, I say, I'm here for healthcare for all Texans. Then I might can have a conversation, even though I'm still not getting where I want to be. But you got to understand the stance of who you're dealing with. We don't send our trans folks to people who are anti-trans without protection, and this is what the other folks can do for us is, get our talking points, take them with you. Let us know when you're going in the room, carry us in the room. If somebody, I'm on a panel, they say, ask me a question for a trans woman, I'm saying, why don't we have one here? Right? Call out what ain't there. Use your privilege to uplift and stop using the verbiage of we're just going after HIV funding. Call the issue what it is. Let's name it. And we can still say, we see what's happening and what we're doing, and we want this. But by pretending, when I have to show up in different places, I almost feel like I got to bifurcate myself, just like Michael's talking about. I'm hearing you're talking about funding and respectable, and I'm being attacked with a tank over here. It's hard for me to join a movement when you're not. It's not inclusive of all of the diversity, because it's mainly run by white cis male men. And so we need folks to take a step back and ask themselves and us the question, how do we be inclusive of your thing? I was on one call and I said, I've been doing this stuff for 40 years and tired. Now, a white man on this, I need to be able to dig deep and continue. How dare you? I haven't been back. No, I was on that call one more time, and I'm not mad at the call, but those kind of comments are truly insensitive. Okay, dig deep. So we need you to show up with some sensitivity. We need you to think about where you should lead and where you should follow. We need you to think about asking us before you go talk. I don't make trans issues. I go ask somebody. So ask us, bring us in the room with you, demand our presence, help us find funding so that we can be there and be an equitable partner, because this power dynamics are off when we're dealing with these big organizations and we're the only one representing people living with HIV and we have no staff. So those power dynamics keep us in playing catch up. So those are just some of the ways.
Yeah, I'd love to jump in here and especially talk about, white allyship in this moment, because it is about refraining within certain conversations and not getting in the way of people with lived experience. But I also think it requires like a personal evolution. It requires people to challenge what they're thinking about, their experiences, their beliefs, and focus on ways that they can improve themselves, because it's partly about listening, but it's also about activating. Because as our ED has said, Mandisa, it's about hearing and understanding the expertise of people with lived experience and then matching their level of intensity in these conversations. And it's showing up in a way that honors their experience and doesn't silence their experience if they are in that space. It requires white people, cis people, and other allies to recognize their position in these systems, but also in the collective fight against this in this administration and other oppressive forces. We're either working against oppression or we're working for it. So allies have to do something. No one can wipe their hands clean. And as Chauncey said, this administration is coming for everyone. So you cannot isolate yourself from its decisions. So, I mean, this is for white people, cisgender people. Showing up within these spaces is about standing up for most vulnerable in our community, but we have to do it in a way that doesn't silence people with lived experience.
And all the time, you know how sometimes you're in the group and they might make a Black joke and we don't laugh, but we don't say shit. Silence is violence now, y'all.
And I just wanted to quickly add, I know that we're running on time, but that's y'all fault for picking all these prolific speakers. Um, uh, we tend to externalize when we a lot when we say collaboration and what does it mean to be an ally. But it also means being an ally and collaborating within our own specific spaces. And again, I'm gonna personalize something. And I know I'm not the only Black trans person that have felt this way, but oftentimes, like we mentioned earlier, like spaces that have traditionally felt welcoming no longer feel welcoming. We were even in some spaces at creating change, and this is not vilifying creating change. We love creating change. We love the leadership over there. And like some seasoned Black trans leaders who I look to for guidance and take notes from were like, I no longer know if I'm wanted in this space. And that's in a queer space. So imagine how hostile at times our HIV organizing and policy spaces are. And so why I'm bringing that up is because there are people like Chauncey on this call. I'm going to try my best not to cry. Vanita on this call. There's people like Esmondisa and Defina Ward, Kamaria Laffrey, people who, even in our meeting spaces, proactively and intentionally say, I hear and see harm being done to communities who we should be allies with, and we need to do a hard stop, first do some healing, and then do some education. Vanita is absolutely correct when she say, like, she's the one that actually pointed out for the caucus that Ryan White was now trying to restrict access to gender affirming care coverage. She's the one that will start asking those questions as a co-conspirator to trans communities, right? Even before I had the time to even process it myself, right? And that's allyship and co-conspiratorship that doesn't necessarily just have to happen movement-wide, but in our own spaces that we're supposed to call circles of trust, if you will. So one, there's an appreciation for people who are already illustrating this. But two, that more of that needs to happen. It tends to lean on Black people, and it tends to lean specifically on Black women.
So we're going to start to wrap it up. I'm going to ask panelists, this is a big question. I'm going to ask you to keep it to like one sentence if possible. So as we begin to close, I'd love to really hear your thoughts on the road ahead. How are you staying grounded in the long-term goals and strategies and values you were pursuing before this administration? And if there's one takeaway or call to action you want people to carry forward from this moment, what would it be?
I think I can go quickly. I think our leadership needs to shuffle. It's like musical chairs. You know how when the music stops, there's like somebody out. I think we've called out a community of people who have been in leadership long enough, and it's just time for them to move. And then at the same time, I think we need to begin to celebrate the accomplishments of the generation that has gone before. I think it's okay to thank you for time served. You know, every moment, every movement comes to a moment like this, where the vision that got us here is not going to be the vision that takes us where we need to go. So let's begin also training and building leaders for this moment that we're in now, making room and space for people of new experience, people who are younger than us, people who have seen the world different than us, Let's start making place for them, putting them, where is their counsel? Where is their seat at the table? Where is their agenda? Where is their platform? How are we bringing them along so that when we make this transition, we've got someone to hand the reins over to?
Yeah, it's hard to do that in a sentence, but this is our moment, right? It's not a time to wait, to wish. It's a time to build, right? Now we need to build what these infrastructures of what public health means for us. This needs to be rooted in community-based solutions, right? We need to use our voice, use our vote. I'm gonna say that again, use our vote, because as Chauncey mentioned, like these old, and I know you were probably talking about HIV, but like this goes beyond like the HIV Inc., right? We need to vote out the leaders that are not serving us right now. You are quiet and you are silent, and as Vanita said, silence is death. You are killing us with your silence, right? The fight ahead doesn't demand perfection, right? It just demands participation. We need to figure out what our role is, because the time is now. Not everybody needs to be on the streets, because I know I'm not asking any Black woman, any trans person, any Black person to be out in these streets right now, right? Because we've done it. We've done the work, right? But we need to find what is our role in this fight, because we all need to fight. Sorry, that wasn't a sentence, but.
I can try.
Oh, you're gonna go? Go ahead, Sean.
Okay, thanks, Vanita. I just want to emphasize like how we need to be more intersectional about this approach, and in these efforts, we have to remain focused on people who are most impacted, and especially people with intersecting marginalized identities. The administration is relying on divisions within this movement, but we have to remain committed to each other, and we can't sacrifice any of our community, especially trans siblings, for the sake of any short-term relief.
I think I want to just say that liberation is a journey, y'all, not a destination. It's a journey, and we are on it. And I would say, and I saw Crystal's question, let's not spend time worried about, and I, even though I said people went in there and voted, we just got to keep turning people out to vote. Don't worry, we keep it up. Now's the time to start. We don't wait till the general election. We got to be in the primaries and stop worrying about if they voted differently. We could turn 50 more. So I just can't remember. We're on a journey to liberation, and find the people and let's bring them.
I'm trying to quickly say a couple of things, and I apologize ahead of time for not following your rule. One, we can't be scared of leadership. We say this all the time, but don't be scared to run for office. I promise you there are strategists on this call and in your network, if you ask, who would help you run a campaign and help you raise funds needed. Also, don't be scared to become not just an elected official, but work for an elected official. Those are actually the real decision makers when it comes to policy anyways, because as a former aide, all my elected official did was vote how I recommended her to vote. And I hope she's not watching this webinar, because then she'll be mad at me. And then second of all, we all need to start investing in appropriations advocacy beyond the federal government. For example, in Texas, well, who knows, whatever, it's too late for them to do anything about it now. We silently, as LGBTQ advocates, advocate for $15 million to be appropriated for Texas ADAP to be able to cover long-acting injectable HIV treatment, right? There are pathways towards local and state funding and appropriations that won't necessarily reach the gap that's happening right now, but can at least alleviate the harm that is happening to our most vulnerable communities. And then finally, the states are where the work is going to be to rebuild this country. I'm going to say it again. The states is where the work is going to be to rebuild this country. And I'm just proud to have be able to work with state partners, but they are being impacted more by what is happening at the federal level than ever before. And it has been even clearer the need for organizing support, training, funding, as Vanita said, and infrastructure building that is never invested enough or prioritized by funders. There's funders on the call. Infrastructure building in itself should be a priority. In all states, we need to work more on building a new, strong, active base to set and realize policy agendas, mobilize for action like testimony, protests, and voting. Scarcity is the enemy of solidarity. Scarcity is the enemy of solidarity. We're all losing funding right now, having program cuts, etc. This is a time really to join together in fighting against this administration, regardless of what's happening in Congress and their attempts to split us up into niche groups by attacking each of us separately. We all tend to care about the same things, and we need to start acting that way.
So I'm going to ask everyone if you can stay on for just a little so we can do some questions that came in the chat. I am sorry if you have to go, I understand. But a question asked by Crystal Townsend. I'd love to hear more about what folks are doing or would be willing to do to disrupt what's happening. I know our current moment is overwhelming and a natural response is to keep your head down and work through it. How do you all see the HIV community especially doing as a response?
That's a wild. I don't. That's a wild question. I would say recalibrating. I know, of course, Vanita would add on. And we've been criticized at times for not being rapid response enough, but it's because we've been very intentional about assessing the ground. One of the first things Vanita wanted us to do was figure out what our new priorities would be in hindsight of this administration. And then the steering committee came up with priorities. Two of those priorities, and I thank the leadership of Marnina from Positive Women's Network, was we need to protect our most vulnerable communities that include transgender communities and migrant communities. And so Vanita's response to that was, what coalition tables are we part of as the HIV caucus that serves those communities? At the moment, or at that time, it was zero. We were all only part of HIV-specific coalitions. And so now we are expanding how we represent it, where we represent it, and making sure that we're all representing people living with HIV from the most intersectional perspective in a holistic way that is healthier for as many communities living with HIV as possible.
Yeah, I think there's some natural ways that I was first quiet because the HIV community has been grappling with how to handle this. And one of, I think, the problems is everybody keeps not really agreeing or trying to address what the real issue is. You know, we're not looking at the root cause. We want to deal with these symptoms. But I think we're struggling to come up with a way because this is difficult. People keep saying we've been here before. No, we haven't. Not like this. No, we haven't. We are used to the struggle, but this is a different struggle. But I would say too, we got reproductive justice movements directly intersecting harm reduction. I see all PrEP and everything as harm reduction, and I know that is not the traditional harm reduction. ART to me is harm reduction. You know, housing. There's just so many lanes to get in and those other tables to be at. How can we start cross-pollinating? How, if you're doing electoral stuff, you should be already started right now, already. Not in 6 months now, because there's no time to waste when we should have started 2 years ago or 3 years ago. So I just really think we ought to be very clear on the issue we're going at and make sure either we're solving a symptom of a problem because our people need to eat. That ain't the whole problem, but it's a symptom of the problem. And then clear about how and this is one of the things we did in the caucus. We know that we have limited resources, so our work is going to be in coalition with others. We don't have the resources to do it on our own. So how are we coordinating with others? And if you want to partner, reach out. But yeah, I just think everybody's still grappling about how to do it. So that's why federal funding is the cleanliness argument in the HIV field right now. But that's a disservice to our community if that's the only issue we are mentioning.
And then for our last question from Ronald Johnson, what is the new leadership that we need to respond? What are the new strategies that we need?
You know, one of the things we always say a lot is MIPA, meaningful involvement of people living with HIV. And I really want us to dig deeper. Oh, come on, Ronald Johnson. I didn't even realize that came from you. You already know the answer to this question. Okay, anyways, it's like, how do we approach MIPA from the most intersectional perspective as possible? So MIPA is, for me, does not just mean meaningful involvement of people living with HIV. First of all, it means following our leadership and expertise, not just involvement. Putting us at a table is not enough anymore, to be clear. Second of all, it means let's be very state specific or local specific. So if most people living with HIV in your state are Black people or Hispanic and or brown people or people that happen to use drugs, those are the people that we need to be meaningfully involved in uplifting into leadership and following their expertise. It's not just enough to put a white woman, no shade towards all of our beautiful white people who are on the call that get sunburned, but like, no, it's not enough to put, we all get sunburned, okay, yes. It's not enough to just put a white person living with HIV on stage and say, that's MIPA. We really have to expand the scope of how we define ourselves and our communities and who's part of those communities.
I'm about mentoring. The whole job, the only article I've ever written that included me, they said, Trump is building a wall and Vanita is building an army. Only headline I've ever liked. And I believe that where we lack in dollars, we got people power. And I believe we even got dollars, to be honest. But we need to be mentoring and developing our young leadership. We should be stepping aside, co-leading, co-chairing with these folks so that people like me and Ronald can step aside. You know, if we don't do that and turning them loose with new ideas, we have people more gender fluid. They're not coming with all the stuff that we came with. And I think it's time for some of that. So we got to trust some of our young leadership. We got to trust some solutions we, you know, those of us that are older may not have come up with, but we want y'all to try them because the book ain't been written yet. And so I want to trust the young leaders. I want to trust that we're doing leadership development, mentoring, that we're building the capacity, that we're sharing our analysis, that we're not hiding information, that we are equipping people with what they need. And since they already got the skills and their own brilliance, and turn them loose and step aside and let them do their thing. We need to give them that leadership and stop worrying about who you love, how you dress, and whatever the hell else people have been too focused on. We have the youth, like people like Chauncey and Chauncey, I'm calling you young, and Michael Elizabeth, but we have them. Let's trust them.
And with that, I just want to say thank you again to all my panelists. Thank you to our audience members. Thank you for being here, for sharing your insight, your work, and your vision. This is a challenging time, a time marked by coordinated attacks on public health, civil rights, and the very fabric of our democracy. But it's also a time of reckoning when clarity, courage, and solidarity matter more than ever. The stories and strategies shared today are a powerful reminder that while the threats are real, so is our collective strength. Whether through policy advocacy, community mobilization, legal resistance, or public education, every one of us has a role to play in building a future grounded in justice, equity, and care. So let's carry forward what we've heard today, the warnings, the calls to action, and the commitments to each other, and use them to sharpen our focus and deepen our resolve. So we look forward to continuing this work together. Thank you again.